hyper-inflammatory oxidative storm that takes place, as many are seeing and observing with SARS-CoV-2 or COVID-19. Why glutathione is important for that. We talked about the relation to insulin. Let's talk about glucose. Again, we're talking about metabolic dysfunction. We're talking about some of the population that has seen some of the worst outcomes when it comes to this. Insulin dysregulation, something we got to reel in. Too much fructose, something we can change, something we got to reel in. Let's talk about the other side, the more commonly referred to side of the diabetes and pre-diabetic side, that glucose marker, the glucose that we're looking at, that blood sugar. When we look at that, when glucose is metabolized in the body, it creates something called NADPH. NADPH, that's part of the process through which the whole dance occurs, the metabolic dance occurs in your body. NADPH is then used for recycling of glutathione in our body. You get that? So if we consume glucose under normal circumstances, a healthy metabolic state, glucose, one of its metabolites, one of the things it's pushed down to is NADPH. NADPH takes that glutathione that we may have used up, detoxing, quelling the oxidation from maybe a virus, inhibiting viral replication. It goes down the list as far as what glutathione does in the body. We may have used that up. It gets changed to another form. NADPH comes in, recycles that glutathione back to a higher level to be used again to help maintain health and resilience and quality of life. The issue comes to play here in the metabolic dysfunction. The metabolic dysfunction and dysregulation that is seen in diabetes and prediabetes. What happens there is that glucose is metabolized to NADPH, just like it should be, but in the state of that metabolic dysregulation, that dysfunction that is so characteristic of diabetes and prediabetes, in the state of that NADPH does not go for glutathione recycling. That NADPH actually goes to fatty acid synthesis. Fatty acid synthesis, which is one of the reasons why when we see the diabetic population, the pre-diabetic population, especially if it's uncontrolled, that's one of the reasons we see with the fatty acid synthesis, all of a sudden it starts to make a difference in those cardiovascular markers, the lipid panel, the triglycerides, the LDL particle and size. All of a sudden some of those negative ones start to rise up, and that's why insulin is often implicated as one of the most powerful ways you can reel in the cardiovascular panel. Rather than just looking at a statin or certain things like that, look at the insulin. That is referred to across the board, and we're articulating some of the mechanisms why that takes place. To that same level, when there is that metabolic dysregulation, like we said, that fatty acid synthesis is taking place. Cornerstones of diabetes, prediabetes, metabolic dysfunction, weight gain, obesity. We can see how it's going down there. We can see that expressed on a phenotypic level. Now we're losing out on some of the glutathione. So now, once again, we've lost some of our defense system. We've lost some of our defense system to this virus that needs glutathione to fight it off. So again, another way that this is playing a role in it. NADPH going to the wrong place at the expense of glutathione and at the expense of our defense to viruses, toxins, anything else we come encountered with. So we want to make sure that endogenous supply of glutathione is intact. One of the best ways we can do it, reel in that metabolism, reel in that blood sugar, reel in that insulin. I'm telling you, you can do it. We do it with people all the time. We see people do it all the time. Doesn't matter where you're starting from, just do it. Do it. Hedge your bet, build up your defense system, and live a better, stronger, more confident life. It's there for the taking. This is supposed to be empowering, not discouraging or judgmental. It's there for the taking. Come on. Let's be better.